Could monkeypox repeat what COVID-19 did to the world? The World Health Organization, WHO, has declared the spread of monkeypox in Africa as a global health emergency, which is the highest level of warning the organization can issue. The virus was first discovered in 1958 in Denmark in monkeys used for research. It was first identified in humans in 1970 in the Democratic Republic of Congo. There are two subtypes of the virus, clade 1, which is more lethal and prevalent in the Congo Basin in Central Africa, and clade 2, which is widespread in West Africa. Below is a comparison between the coronavirus and the monkeypox virus in terms of transmission and symptoms. 1. Transmission. The coronavirus and the monkeypox virus are entirely different. The former is classified as a coronavirus, while the latter belongs to the enveloped viruses. This difference makes COVID-19 more capable of spreading and generating variants, according to the American Society for Microbiology, the largest and oldest organization specializing in virology, bacteriology, and mycology. The coronavirus is a respiratory virus that spreads when an infected person exhales small droplets containing the virus. If another person inhales these droplets, or they land on their eyes, nose, or mouth, they may become infected. Because COVID-19 spreads efficiently through the air, it is difficult to control, as one person can infect many others simply by breathing. Moreover, infected individuals can spread the virus even if they do not show symptoms. In contrast, while monkeypox can be transmitted through respiratory secretions, it is not primarily a respiratory virus, making it less transmissible. Monkeypox primarily spreads through direct, usually prolonged, contact with an infected person, especially when touching the rash caused by the virus or body fluids. It can also spread by touching objects and surfaces that an infected person has used and that have come into prolonged contact with skin lesions. Sexual contact is also one of the main ways the virus spreads, and pregnant women infected with the virus can transmit it to the fetus during pregnancy or to the newborn during childbirth. 2. Symptoms. Symptoms of COVID-19 usually appear 2 to 14 days after exposure to the virus and may include fever, chills, headache, sore throat, and loss of taste or smell. People typically feel better after a few days to a few weeks, although some individuals experience long-term symptoms lasting more than 3 months, known as long COVID. The risk of severe COVID-19 depends on several factors, including the variant causing the infection, vaccination status, age, and whether the person has chronic illnesses or acquired immunodeficiency syndrome (AIDS). In the case of monkeypox, symptoms may take up to 3 weeks to appear after exposure to the virus. Although symptoms vary from case to case, they can resemble early COVID-19 symptoms such as fever, headache, chills, muscle and back pain, and fatigue. However, clinically, monkeypox differs from COVID-19 as it involves the appearance of pus-filled blisters and a rash that can be painful and itchy, often spreading to the face, limbs, and genitals. Most people recover from monkeypox within 2 to 4 weeks. The disease can be severe and even fatal in certain cases, such as those with chronic illnesses, but the mortality rate is nowhere near that caused by COVID-19. According to the World Health Organization, the global outbreak that began in early 2022, when the clade 2b variant spread, resulted in the death of about 140 people out of approximately 90,000 cases.